Hey everyone, welcome to my channel. Today I'm going to talk about femoral triangle. Femoral triangle is so important because there are some important structures passed through it. Femoral triangle is found in upper thigh. It's found between the junction of anterior abdominal wall and muscles of upper thigh. So in this diagram, you can see the location of femoral triangle. So femoral triangle is a triangular depression on front of upper 1/3 of thigh below inguinal ligament. Below the inguinal ligament. Inguinal ligament makes the base of femoral triangle. Let's talk about the boundaries. Laterally, medial border of sartorius. Medially, medial border of adductor longus. So as we can see here in this diagram, laterally medial border of sartorius and medially medial border of adductor longus muscle. And above here its base formed by the inguinal ligament, and then apex is directly downwards, is formed by the points where medial and lateral boundaries cross each other. So roof. Let's talk about the roof of femoral triangle. Now the roof contains skin, superficial fascia. So superficial fascia contains superficial inguinal lymph nodes, femoral branch of genitofemoral nerve, branches of ilioinguinal nerve, superficial branches of femoral artery, and upper part of great saphenous vein. Then we've got the deep fascia. Deeper to superficial fascia, we've got the deep fascia, including cribriform fascia, covering the saphenous opening. Now, cribriform fascia, a thin tissue layer, it covers the saphenous opening. So, we are going to discuss this diagram later in the video in detail. So let's talk about the floor. Floor is formed medially by adductor longus and pectineus, and floor is formed laterally by psoas major and iliacus. So as you can see this diagram here, muscles of femoral triangle forming the floor. So these are the muscles forms the floor of femoral triangle. So on medial side we have got pectineus and adductor longus. On lateral side we have got iliacus and psoas major muscle. So I hope this diagram is clear to you guys. So now let's talk about the contents. So the contents of femoral triangle are femoral artery and its branches, femoral vein and its tributaries, femoral sheath, and there are several nerves: femoral nerve, nerve to pectineus, femoral branch of genitofemoral nerve, and deep inguinal lymph nodes. And there is lateral cutaneous nerve of thigh. Now let's discuss the content. So femoral artery and its branches. Transverse is the triangle from its base. So it transverses the triangle from its base at mid-inguinal to the apex, and it gives off 6 branches, 3 superficial and 3 deep. Femoral vein and its tributaries. Vein is medial to artery. Now femoral vein is medial to the artery. As you can see, the femoral artery in red, and medial to that there is femoral vein in blue. So femoral vein is medial to femoral artery. So we have got femoral vein medial to femoral artery. Just remember this, because this diagram is so important. Contents of femoral triangle is literally important. Femoral triangle can be asked in short note as well as long answer question. So you gotta understand the content in detail. Posterior medial at apex of triangle, femoral vein receives great saphenous vein, circumflex veins corresponding to branches of femoral artery. So there are tons of veins. It receives tons of veins. Femoral sheath encloses upper 4 cm of femoral vessels. Now, as you can see here in the diagram, femoral sheath, yes, this one, it encloses the upper 4 centimeters. So it encloses the upper 4 centimeters of femoral vessels. These are the femoral vessels, and it encloses them. Nerves. So femoral nerve lies lateral to femoral artery. Femoral vein lies medial to femoral artery. Femoral nerve lies lateral to femoral artery. Now remember this thing in your mind. Femoral vein lies medial to femoral artery. Femoral nerve lies lateral to femoral artery. As you can see here in this diagram, the diagram represents femoral nerve. So it's lateral to femoral artery. So in the middle we can see femoral artery, and medial to that femoral vein, and lateral to that it's femoral nerve. And femoral sheath encloses the upper 4 centimeters of femoral vessels. Nerve to pectineus arises from femoral nerve just below inguinal ligament. Just below inguinal ligament, the base. Nerve to pectineus arises from femoral nerve. Nerve to pectineus arises from femoral nerve just below the inguinal ligament. Femoral branch of genitofemoral nerve occupies lateral compartment of femoral sheath along with femoral artery. Now along with the femoral artery, genitofemoral nerve occupies lateral compartment of femoral sheath. Then lateral cutaneous nerve of thigh crosses lateral angle of triangle, runs on lateral side of thigh and ends by dividing into anterior as well as posterior branches. Lateral cutaneous nerve of thigh or lateral femoral nerve, it crosses lateral angle of the triangle and runs on the lateral side of triangle, lateral side of the thigh, and ends by dividing into anterior as well as posterior branches. So once again, crosses lateral angle of triangle, runs on lateral side of thigh and ends by dividing into anterior as well as posterior branches. Last but not least, deep inguinal lymph nodes. Lies deep to deep fascia, medial to upper part of femoral vein, receives lymph from superficial lymph nodes. Deep inguinal lymph nodes receives lymph from the superficial lymph nodes, from glans penis and deep lymphatics of lower limb. So this was the video, guys. Boundaries as well as contents are extremely important of femoral triangle. In the next video, I'm going to cover femoral sheath as well as femoral canal. Femoral sheath and femoral canal are both short topics, and I'm going to cover it in one video. So thanks for watching. Till then, bye. See you guys in the next video.